Hi.
Hi everyone.
So today's video is gonna focus on how to do coning therapy for amputation. So obviously I do not want to use an actual patient in this. My charming associate will be helping me. So let's assume that this is the stump and the stump is blunt, it's sort of squarish. So just fold it gently. It's more like this. It's like a rectangular thing, but we really want it to become into a cone shape like this, so that it sits well within the prosthesis, the future prosthesis. So assuming that this is the knee joint and this is the stump and then this is the thigh. So the first thing is that you clean it thoroughly with soap and water and then dry it up. Then you take a moisturizer. I'm using the Dermaco oil-free moisturizer for this. No particular reason, I like it. And then you just really smear that on. Nice thick generous layer. Make sure you get all of it. Like assume this is the suture line, this is where the stitches were placed, so you really put that in nicely. And after this is done, you take the sock. So this is my favorite sock. I've reused it multiple times in my videos, but it really does do the job. You place a sock on it. So it can be a thicker sock or a thinner sock, but it has to be a sock. Crepe bandages are never applied directly on skin. Please note, crepe bandages are never put on skin directly. You're asking for skin ulceration. So assume this is all like, sealed up, okay? So when you put the sock on, you have this tubular structure here. Now we have to convert something flat into something cone shaped so that the prosthesis sits well. So we're going to use a crepe bandage. For it, I'm using a 4-inch crepe bandage for this. You can use a 3-inch bandage if your stump side and your legs are slender. So the first one is to assume that this is the knee joint and this is the stump. So we go slightly above the knee joint or at the knee joint, and the first fold is from the front to the back, and then at the back you have to hold tight here, and then you come back forward, but you come back from the sides, and then you come back on the other side. So there's this, I'll just show this one more time. We're going to take a circle roll and then close this up a little bit. Okay, so we have to go from the front to the back. That is compression fold number 1. Then we go from the side to create this word pressure. And then we go from this side to create that word pressure. So 1, 2, and then 3, and then you just seal it all up. It won't be perfect the first few times, but as you do this, you'll notice that your stump is looking more and more conical. I think that is what we're trying to achieve here. And then crepe bandage is something that you can use very comfortably even when you're wearing your prosthesis, so that it sits well and there's a good even pressure that is there on the stump. So that is done. That is going to transform a square stump into a conical stump. So